Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about the 2 supplements you can take when you are taking antibiotics. The reason I'm making this video is because I see so many patients who have gut issues coming into the office. And one of the most common factors of these patients are that they have been on antibiotics or chronic use of antibiotics as children. So the child who gets the repeated strep throat or the repeated ear infections, and they go on rounds and rounds of antibiotics through their childhood years. Those are the patients who come in and have chronic health issues. So let's get right into the 2 supplements you can take for antibiotic therapy. So let's get right into it. The combination of a probiotic and an antibiotic can prevent antibiotic-associated diarrhea. Okay? They've done studies where they find a meta-analysis where one of the most common infections that use antibiotics is H. pylori or Helicobacter pylori. So the common use is used in H. pylori, and if you use a probiotic along with the 2 antibiotics that you'll be on, you can reduce the effects of GI disturbance or decrease diarrhea by 45%. Okay? Improve the eradication time. So if you actually use the probiotic along with the antibiotics that you're utilizing to get rid of the H. pylori, you can actually eradicate it or improve that outcome by 10%. Reduce the risk of infections. So post-surgical sites, when you get infections, right? Because you're on antibiotics and there's open wounds and so forth. If you use a probiotic, you can reduce surgical site infections also. Reduce abundance of antibiotic-resistant genes. If you use a probiotic called Saccharomyces boulardii, it has shown to reduce the resistant genes that will be activated with these antibiotics. It will preserve the gut microbiome, the alpha diversity, right? It will preserve gut function. Sometimes if you're on antibiotics or repeated antibiotics, the gut microbiome may never come back, or it may take up to 2 years to come back. So in order to prevent that from happening, the probiotic along with the antibiotic would be most beneficial. And I'll go into how you would take it and so forth in a minute. So the 1 supplement was probiotics. The 2nd supplement would be short-chain fatty acids. So if you're on antibiotic therapy, what happens is the antibiotic therapy will decimate the gut and the bacteria that produce short-chain fatty acids. You need short-chain fatty acids because they're the fuel for the other bacteria in your gut. So what are they? They're called butyrate, acetate, and propionate. Right? So if you decrease the gut flora, you will decrease short-chain fatty acid production, and because you reduce short-chain fatty acids, you will increase colonization of Candida albicans. You will disrupt what we call symbiotic adrenal response, right? Those people who have low blood sugar issues, they can't respond and they have a decrease in energy or a crash in their energy. It also will increase gut inflammation. Decreases the synthesis of tight junctions. The tight junctions are the bonds that prevent things from crossing into the bloodstream. They're called zonulin or occludins. Essentially, because you have a reduction in the production of the tight junctions, you will develop what we call leaky gut or intestinal permeability, right? Or dysbiosis. It will increase expression of antibiotic resistance genes. So you'll have antibiotic resistance for future infections. Increases the virulence of E. coli in your gut. And then it will also increase inflammation as a result. So, butyrate, acetate, propionate. Take a probiotic and take short-chain fatty acids. So this is my strategy. if you know you're going on antibiotics, 2 weeks prior to knowing when you're going to go on, you take Saccharomyces boulardii and short-chain fatty acids. Okay, I'll link some of the products below. But you'll take those for 2 weeks going into taking the antibiotic, or maybe into a surgical procedure. Okay? You'll continue taking the Saccharomyces boulardii and the short-chain fatty acids throughout the antibiotic period. So you'll take it away from the dosages that you're taking for the antibiotic. So if you take an antibiotic in the morning, wait a couple of hours and then take your probiotics and your short-chain fatty acids. Okay? After you're done with your antibiotic therapy, continue with the short-chain fatty acids and Saccharomyces boulardii for an additional week. And then you might want to convert to a broad spectrum probiotic. Okay? There's a lot of companies that produce them. I like Ther-Biotics. They have a line of really high quality probiotics. So you can use them. And I'll link those below. But that's how you really want to use probiotics and short-chain fatty acids if you're going to go on antibiotic therapy. So let's say you get sick and you don't know and you have to take the antibiotic and you don't have access to probiotics and so forth. You can try fermented foods through the antibiotic therapy, like kimchi, sauerkraut, dill pickle, etc. You can always do the probiotics after you're done. It will start to replenish. Right? So you can do probiotics and short-chain fatty acids for, let's say, a month after you're finished your antibiotic therapy. Right? It's never too late. So you want to make sure you're getting fermented foods. You want to get maybe like a vegetable mash or like a vegetable smoothie to diversify the gut and improve short-chain fatty acid production. You can also, in the worst case scenario, let's say a patient comes in and they've done everything under the sun. They've been on antibiotic therapy for years and they just don't feel well. Probiotics don't help. They're always bloated and they just don't feel well, right? The other option is actually what we call a fecal transplant. Okay? In the United States, it's only available for people who have C. diff, right? A chronic issue with that infection where it causes diarrhea and it creates a lot of problems. That's what it's approved for. But there are clinics outside of the United States that will provide fecal transplants. And these fecal transplants, for those people who can't get better, can be life-altering. Okay? However, it's not something that we prescribe in the United States. It's just not available. But it is available outside the country. All right? So those are your different options for taking the 2 supplements for antibiotic therapy. My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you guys next week on the healthy side. Have an awesome day.